I would also say it's transformational because it makes you see things very differently. It's Malaysia, but it's a different part of Malaysia, and it's gonna open up your eyes to see like healthcare is not just like what you see in the textbooks. If the winds are strong that day, then usually the boats they say they won't sail. So then they have to call us and cancel appointment. My friends, he said, sebab kawan saya eject saya macam gigi macam dragon. Kan lepaskan angin, dia kasih gigi kamu tidur. Time tidur.
That's so cute.
Kita kasih keluarkan gigi kamu. If people don't come to us, how are they gonna even know how important oral healthcare is?
Hey everyone, welcome back to the Nothing But The Tooth podcast brought to you by the Malaysian Dental Students Association. I'm your host, Jen Shen. In today's episode, we're exploring a journey where a lot of dental students fear of, but our guest call is life-challenging. So joining us today is Dr. Faith Chuah Ci Kim, a dentist who moved from the city lights of Kuala Lumpur all the way to the heart of rural Sabah. Let's welcome Dr. Faith.
Thank you for having me.
Okay.
Thank you.
So before we dive into the whole Sabah experience, can you give us a quick intro for those who are new to your journey?
Okay. Hi guys, my name is Faith. I'm Dr. Faith. I am currently practicing in a private practice in Kota Kinabalu, Sabah. But previously I was in Kota Belud, Klinik Pergigian Kota Belud. It's more of a rural area in Sabah. I was there for close to 4 years.
Oh, wow. That's a very good experience that we can talk a lot about that. Okay. So, about rural Sabah, a lot of dental students honestly quite scared of getting posted to rural areas. So, what's it really like working in Sabah compared to KL? Like, is there anything that really surprised you when you first arrived there?
I think everything felt different. Like although it's Malaysia, right? But it seemed different. The races there are not the typical ones here. Like it's more of the indigenous races there. You get a lot of Kadazan, Dusun, Bajau. Language. Although it's Malay, but it sounds different.
The slang.
The slang is pekat, like yeah, it's different. Yeah. And so it took me like some time to understand like what the patients were telling me. Communication was difficult. All the nurses in the clinic, the sisters as well, they talk so fast, like they're singing like that. But it took like around 3 months. Then only slowly, I kind of got used to it. But they've been very nice. They're all very, very warm, very friendly. Like they never once made me feel like an outsider.
That's nice. Wow. Then, Dr. Faith, I'm really curious, was there any like culture shock when you first started working in Sabah?
Culture shock.
Because just now you were saying like, oh, all friendly, all nice, all good. Was there any like culture shock? Like for example, with we know that a lot of patients in Sabah or rural areas, they might have their own traditional beliefs. So is there any culture shock like that?
Yes. This one, I think you guys have heard of this before. So a lot of times, like when it's a difficult extraction, right? Sometimes you would suspect it's like maybe root divergence or maybe the bone is very dense. But in Borneo, they have this thing where like some people, they pray to a kind of god or like they have a specific charm. Okay, so like they have that charm on. So that charm like basically protects them from any harm. So it keeps their tooth, their body like together. So like sometimes extraction can be hard. So for example, there was this senior of mine who told me this story. I didn't experience it. I wish I did, but so she said there was one time it was a difficult extraction for this uncle. And then she asked the uncle if there was anything that he had on his body or in his bag, if it's okay to remove it outside first. So what she meant was more of these spiritual kind of this thing. So then the uncle said yes, he had it in the bag. So he took the bag out, and then when he came in back to the clinic, he sat down, and then the tooth came out.
Wow, that's so bizarre.
Yeah, but it's quite common actually in Borneo. So yeah, it is.
I also heard this from my Sabahan friend. She said like it's not specifically a charm. It can be something like anything hard. For example, a coin or a rock. Yeah, she told me this, and I was like, wow, it's so bizarre.
It's different. I mean, I wish I was there to witness it. Then I can tell the story better. But this is her story.
I see. Okay, so I was looking at some Ministry of Health data that really blew my mind. Like some rural districts like Kota Belud or Kanawit have a dentist to population ratio exceeding 1 to 5,000 compared to just 1 to 200 in Putrajaya. So this gap actually highlights access to care isn't just about treatment, but it's also about prevention, I believe. So could you share any memorable outreach initiatives that you have done to improve oral health in underserved communities?
Actually, in KKM, especially in rural areas, we do more of these outreach programs. So we have like two main ones. We call it Jom Masuk Kampung, and one more is Kampung Angkat. So for like example, Kampung Angkat, it's the government initiative where the clinic, our clinic Pagigan, will go to different pedalaman kampungs to go house to house to do dental checkups and extraction. No, we didn't have extraction. We would refer them to the clinic to get extractions or other treatments done.
They just do screening.
Yes, we did like oral cancer screening as well and normal dental checkup, the chatting basically. So like at first I didn't understand like why we have to do this. We masuk the kampung, it's really like the wooden type of houses where like the houses are on the stilts lah. You have the chickens running around, like really kampung. And although it's hot and all that, we wear like PPE as well, but you still have to take off your shoes. When they give you permission, you enter, then you check like the whole family's teeth. The lighting is bad, so you have to bring your own like headlamp.
I think I saw it.
Yeah, that one is your best friend, I tell you, with a headlamp, especially when you go to school as well to work. It's so hot. But you still have to do it. And I think when I got to see like how people, the different kind of living conditions that people were living in, I think then it kind of was an eye-opener to me to like stop complaining. It's
difficult.
Yeah, and all these people, right, because they don't really have access to the clinic Pagigian. This kind of kampungs could be like 1 hour away. So like they have to take a car. Sometimes they have to tell the ketua kampung like, okay, we want to go. So like they will get a car for them on this specific day to all go to the clinic together.
Wow.
Yeah, so definitely access to healthcare is
very difficult for them.
It's not like if you have a car, you can just go to your nearby like clinic 7 minutes away. Yeah, but this one, and the roads also, like the roads to come out from the kampung is like gravel. You know, it's not like the typical tar roads, so it's different. But and also like when you go to house, right, dental checkups and all that, like I didn't get why, but after that I kind of understood, because if people don't come to us, how are they gonna even know how important oral healthcare is?
Yes.
So then when we went to them, we actually gave them education as well on like how to take care of your teeth, because a lot of them, they had like very poor oral hygiene. So
even children?
Even the kids.
Oh my
like
God.
The young kids, like all caries, a lot of ECC cases. So when we kind of educated them on how to brush, how often to brush, all these things, I think even though they do know that they have to brush, but it's also like reinforcement. And some you find even like parapical abscess, like all these lesions and all that, then you can straight refer them to the clinic. Some I remember there was this one like thyroid case as well. Like it doesn't have to be dental, but it can be medical.
So need more referral as well.
Yeah, you can help like link to like the medical side as well. So it's good lah to have all these initiatives. It's humbling.
Wow, that's really powerful. And I think a lot of us tends to focus on treatment, but we forgot how important prevention and education are. And I guess that becomes even more important when resources are limited, right? So when you're working in a setting with limited resources, how do you actually make sure your treatment still maintains a high standard, even without all the advanced tools like 3D scanner and things like that?
In the clinic Pagigian in KKM, I feel like they do provide equipments that are sufficient for basic treatments like scaling, filling, extractions, denture, fabrication. Like it doesn't have to be a lot, but it's sufficient. Although sometimes you have a lack, like sometimes we don't have the rubber dam sheet. K-files are like Bangkok here and there, like poor quality because it's like wear and tear. I even one time heard like this other friend's clinic, they ran out of patient bib. So like what they had to do, they had to cut out from the PPE and use it as a patient bib. So I guess we kind of make do with what we have.
Yeah, just adapt with the situation.
Yeah, but of course, some of us, we definitely go out of our way to get equipments to help better the service. So, like for example, one of my friends, he actually got the endomotor. He bought the endomotor and he shared it. He let the clinic use it. And then like some also got loops. So, like even though the equipments may be in lack, but we still try to provide the best care we can. Yeah.
Oh.
Like sometimes the composite shades also, it's usually just the same two shades, A2, A3 only.
Oh.
So you just tell the patient, okay, this is what we have, A2 and A3. If you want to do anterior filling, like some people, they come in requesting like a
aesthetic punya.
to fill up like the diastema or something like that. Then you tell them beforehand, like, okay, these are the shades we have. It might not be like the most aesthetic. If you want aesthetic, maybe there are other better options like going to private clinics and all that. But if you're okay, yeah, we can do with this. But most patients who come in, I feel like they require more of like pain relief. Like they come in because of pain, so like, help me get this filling done. So they don't really care about what shade it is. Yeah.
You said all just now. I'm curious that when the patient like travel for hours or sometimes even by boat for just a single dental visit, so there's often a pressure to provide a one visit solution. So how do you balance the ethical need for long-term and ideal treatment with the reality that follow-up may not be possible?
Okay. Yes, because there is like an island called Pulau Mantanani. This island is away from our clinic, and our clinic is the nearest 20 pergian for them. So how they're gonna get to us is usually like an hour of boat ride and then 30 minutes of car. So it is a long journey. Sometimes, like even if they have like an appointment for denture, root canal, and all that, but if the currents are strong, if the winds are strong that day, then usually the boats they say they won't sail. So then they have to call us and cancel the appointment. So usually patients would just prefer to just extract as opposed to following up for like endo treatments, unless they really want to save that tooth, but it's very rare. I feel like in rural areas, patients are more prone to just going for the easiest and fastest solution.
Yeah, just pain relief.
Pain relief.
That's good.
Yeah, as opposed to like in the city, like people,
city people, they might have more awareness on saving their tooth.
Yes, they do have more awareness, more education. That's why even sometimes if it's like grossly decayed, no crown already, they still ask the dentist to save that tooth. But in KKM, back there in Sabah, usually it's just the fastest solution.
Just extraction.
Because sometimes to get like an appointment for root canal as well, it takes like, the waiting list is like 5-6 months. That's for our clinic, but obviously it's not the same for all clinics in KKM. Just a few, because different clinics, they have a different system of working as well, the schedule wise. So sometimes they just rather not wait the 5 months and just get it removed instantly, which is a bit sad.
Yeah,
a bit sad, but
because they also not sure if they can commit it for all of the appointments, right?
Yes. But of course, it's our role as well to tell them the options. Like you cannot just say, okay, let's just extract. Sure. You have to tell them also like, okay, there is root canal as well that you can consider, if you want to save a tooth. Because like the education follows down as well. Like they can teach their kids about it. So it's good for them to pass down the knowledge. Because a lot of them also, they never knew about dental avulsion. You have to place your tooth back and all that. A lot of them just buang the gigi saja. So I think when we were there, we kind of educated parents a lot about that because we saw a lot of avulsion cases. So tell them, okay, you put it in milk lah and all that and bring it back, then we can try to splint it for you.
So in dental school, we talk a lot about informed consent as well. So how do you actually translate that vibe, or how do you actually build your own way to communicate with the patients so you can build trust with them, especially for patients that are very scared of dentists?
Okay. Yeah, a lot of people are scared of you. Sometimes even before, like they sit on the chair, they say, "I'm scared of you." Yeah, they do. I mean, they do come in with like fear and anxiety, right? So it's very important to, do it your style, your way. If you're soft-spoken, that's great as well. Some patients like it. If you're gentle, be gentle. But it's important that before you do anything, that's for my style. I would usually calm the patient down first, make them feel at home, ask them like, "How are you?" And then before I do anything, I usually tell them what I'll do first before I get it done. So like say if it's a kids extraction, I'll tell them, okay, sekarang this one is a kapas. Kapas ni lembut-lembut saja. Yeah, it's just soft, like it's not harmful. Kita mau lap-lap sikit gusi kita. And then after that, okay, sekarang kita ada pen ni, pen istimewa ni. Kita mau kasih letak dalam gigi, digusi. Okay, yang pen ni dia akan macam tiup satu balon di dalam dalam mulut kamu, okay? Nanti kamu akan rasa macam ada balon di sana. Lepas tu dia akan lepaskan angin, dia kasih gigi kamu tidur. Saya tidur.
That's so cute.
Kita kasih keluarkan gigi kamu. Something like that. Yeah.
Wow.
So you tell them step by step, and then they will understand what you're gonna do to them before you do it. Then that gives them a better understanding. So instead of just like going in and like take it out,
they will cry like, "What are you doing?"
Yeah,
it's like why it's so painful. Yeah.
Exactly. Even for adults as well, like you want to be told first what someone is doing to you before they do it, right?
Wow. I love how you explain to the kids. It's so cute. And if I were a kid, I would like, oh, this kakak is so nice.
I mean, you have to like use very imaginative words for them. Yeah, because they like it. They like it.
So in your videos, you mentioned that you really enjoy hospital postings. Are there any cases that stood up or left you a strong impression during your hospital postings?
Okay, there was this one case that we saw. I saw this patient in our clinic itself. Then we got her referred to hospital. So this patient came in. She was a very fit lady, like very active. She was walking fast. She was talking, smiling, and all that. She was wearing a mask. So then I was doing OPD in the morning, outpatient. And then ngam she came in. Then she sat down. We said hi and all that. Lepas tu, then I asked her, selamat pagi, apa yang kita mau buat hari ni? And then after that, she said, mau cabut gigi. And then I said, oh, okay, boleh kita buka mask ke? And then she took out her mask. There was a whole swelling here, like crusty, like exophytic. You study oral pathology, right? Like the verrucopapillary type, there's ulcers. Intraorally, it was bad as well. Oral hygiene was bad. She only had a few teeth left. Periodontitis, very bad. Even the ulcers and all were extending like inside the mouth.
Oh my god. A lot of lumps, bengkak-bengkak.
Pus. Some were pus like coming out as well.
Oh my god.
Of course, like I referred this case to Queen Elizabeth Hospital because we have OMFS department there. She got her referred, then did a biopsy, and she was diagnosed stage 4 cancer. But the story is, back in her kampong, this started with just one small lip swelling, very tiny, okay? And she has a habit of betel nut chewing. Siri Pinang. Yes.
The biggest risk factor.
Yes. So it's very common in KB. A lot of them, it's like a habitual thing. A lot of them, they see their grandmas, their moms do it. So then they started it. And it goes on till like they're 40, 50, 60 years old. So she had that habit since very young. And then so that swelling started. And then people in her kampong noticed it. And then it started growing a bit bigger. Then they asked her, you jumpa doctor already ke tidak? And then she said, no nila, because no pain kan. So then she just left it there. And then slowly she became known in that kampong as like the auntie with like the swelling there. So it's like normal for all of them to like, it's just a swelling, or it's like the auntie with the mole like that. Begitu. So Slowly, I think it got bigger, and then she started feeling pain. That's when she decided to come in and also ask for an extraction as well. After we got her referred, diagnosed and all that, she in the end decided not to continue with treatment. Yeah. But yeah, this is the reality in rural healthcare. Because in Kota Balit, we see a lot of oral cancer cases because it's the district with the most cancer cases in Sabah. In Sabah. Because of the betel nut. I mean, in hospital itself, I saw a lot as well. Like, you get to see the process from diagnosis, and then the specialist like breaking the news to the patient. Then you get to see like some patients, how they take it. And it's very sad. After that, I remember seeing this op as well. I think it took around like 12, 14 hours straight, like non-stop. The specialists were there, 4 of them. It was a oral cancer stage 4 case. So then like an op. So then they took like a graft. It was a graft, and then they harvested from the thigh and then put it on tongue.
Wow.
Like they dissected the lymph nodes, and then they removed part of the tongue as well. So then they placed the graft over there. If you're on call, like to check the ward patients, then you have to go and check like the vitality of the graft every few hours to see if there's the pulse there.
Oh, wow.
So yeah, but it's kind of sad because after the op, there's still a long period of rehab for them.
Yes. So, doctor, you have mentioned in your reels that moving from asking, what can I get here, to what can I give here? So, there's a really huge shift of mindset. So, was there any specific moment that really triggered that change for you?
I think it was a few like small moments that made me realize that. Because when I first came to Sabah from KL, things were very different. Living conditions were different. I didn't have McDonald's there. There wasn't any like pilates studios there. There wasn't any like super fancy cafes that you get around in KL. Yeah. The roads are dark as well, so traveling can be a bit dangerous. But yeah. So then I complained a lot, like, how come I don't have this? How come I don't have that? And then at one point I realized, okay, this is gonna be a loop and it's tiring. So then at the same time at work, I had quite a few like fulfilling moments as well. For example, like I did a lot of anterior fillings for kids in school. So like, for example, like this girl came in and then we did like a checkup for her fist. So like she had a green card there, and then she sat down. Then there were the other kids as well with the green cards queuing up. All her friends were there, like close friends as well were there. So then when she sat down, she used a card to like cover her face, her mouth. She didn't want her friends to see her teeth condition. So I was like, adik, doktor kena check gigi kamu ni. And then she's still like malu-malu lah, but like we try like, okay, can cover a bit, but at least I can still check. So then it was all like anterior cavities, mesial distal, a lot of it. I'm very willing to spend time for it because I don't know, it's my passion as well, and also a perfectionist, which isn't necessarily a good thing. So then we did the filling, and after the filling, usually I'll let them see the mirror, and they will usually like smile, like the biggest smile, because they come in like sad, you know, like murung, like sour face. But after that, you see like a big contrast in like their confidence. They start
so
smiling.
cute.
Even guys, like teenager guys in SMK, and some of them like 16, 17 years old, cavities, upper teeth. After the filling is done, wow, they smile like gangster walking out like that. Wah, boleh
Like
cari.
flexing their smile.
Yeah, so wah, boleh sudah cari girlfriend sudah ni. Yeah, so it's very fulfilling. So then I thought, not just this, but like when we educate like patients as well, sometimes in KKIA as well. So this is like the clinic for pregnant women and toddlers. So a lot of times when you just give education to them, teach them how to take care of oral hygiene during this pregnancy time, because that's when you get hormonal changes, you get like gum diseases as well. I mean, they're more prone to it. So like you'll tell patients not to brush their teeth after they vomit from morning sickness. So like a lot of times they're like, oh, I didn't know that. So like in this kind of education, then you realize, like even though it's like small advices that you are like scripted, you tell them every time, every day is the same thing. But to a person, it could be a new habit that they can start to form, and it can be life changing for them. You know, like even though it's a small thing, like just gums, but it can be a big change. Like the way, like you teach them the proper method of brushing as well. Sometimes patients with like very terrible gingivitis, right? Very terrible oral hygiene. You see them, you teach them how to brush their teeth. The next time they come see you, their oral hygiene is so much better, and then they tell you that they're practicing the method that you're using, that you taught them, and it's helping. So it makes you feel like full, like wow, I'm actually helping someone, making an impact. Yes. So it's more of these kind of little moments that make me feel like, okay, maybe put your complaints aside and put other people's concerns. Put other people's concerns before you. So then there's, I feel like there's more purpose in life. Like there's so much more that you can help for other people as opposed to just focusing on your needs.
Wow. So speaking of this, some people might say that, oh, you're missing on city-based opportunities. So, but it seems like you found your real fulfillment with health equity work. So how has rural path shaped your own sense of happiness, and maybe even influence your own creativity on social media?
I think what I like most about being in rural Sabah was the community there. Like people were very, very nice. A lot of patients, they come, they bring like baskets of their own plantation, their fruits for you, the rambutan.
So
I remember like, I think one time after the whole Kampung Angkat program, because we work with the wilayas, with the ketua kampung, like when we're gonna go, which houses we're gonna visit and all that, on which date and all that. So there was this one time he came and then he brought like 3 big baskets of like durian tau. It was so good. It was so good. Like every day we had durians in the clinic.
Wow.
But the community there, I feel like they never once made me feel like an outsider, like I said. Yeah. Like they know you're from Semenanjung, but sometimes we like cook together in the afternoon. The nurses are basically like my family, because a lot of them, they are very senior already, like 40, 50, 60 years old. So they're like my aunties and uncles there. Colleagues were very nice as well.
So it's the people there.
The patients as well. I feel like sometimes you think that you are there to teach them something, to help them, but sometimes it's them teaching you a lesson as well. It's different. Like, okay,
win-win situation.
Yeah, okay, this is off topic lah, but there was this one, like, I think this was when we did treatment in school. So I think he was around 7 years old. Very, very tiny boy. He was so cute. So he came, and then I saw like he had a little mesodents there. Then I called for a consult. I called orthodontics and also peds. So I consulted them, see what should we do for this kid if he wanted treatment. So then they said, okay, why not refer him over to the hospital in KK, Kota Kinabalu. But we were in Kota Balut. This is like 1.5 hour, 2 hour car ride. Okay. So then I asked the kid, I was like, adik, kamu mau buat rawatan ke? And then he said, mau. And then after that, I said, okay, tapi rawatan tu kena buat di hospital di KK. Boleh kah? Kamu ada transport, mami daddy kamu boleh hantar ke KK kah untuk buat rawatan? And then he thought about it for a while. And then he was like, tidak dapat. And then I said, oh, kenapa? And then he said, like daddy saya bilang, tak ada duit untuk minyak. Yeah. And then he said, biasanya like they go to KK only once a year for Hari Raya saja.
Oh my god.
And kalau kadang-kadang lah, like his sister works in KK, so sometimes she will come, bring the family, jalan-jalan di KK, but that's a very rare occasion. So he said the dad wants to save money lah. So then when I thought about it, when I heard it, my heart just dropped, because like I was doing Kota Balut and KK every weekend. Like every weekend I'll be going to KK. sometimes for locum, sometimes for entertainment, cafes and all that lah. Sometimes I even complain about like the food and all that. But when I heard what this boy said, like he didn't even have the transportation, the opportunity to go to KK for dental treatment, I was like, oh, okay, I'm gonna stop complaining. Yeah. Wow. So then I told him, okay, tiapa, next time when you grow up, okay, you save your own money, okay, and then you can go get treatment done. And then I asked him like, why? How come you want to get treatment done? He said, because my friends, he said sebab kawan saya eject saya macam gigi macam dragon, begitu.
Oh,
yeah, so he wanted to get treatment done, and it's funny because they're only 7 years old.
Yeah.
And you get mocked by your friends already. You get judged already. So definitely, dental care, dental aesthetics is so important even at a young age for self-esteem. Yeah.
So for the students watching this who just got their posting to rural area and is scared, what is one unknown beauty they might not expect but should look forward to?
I think I emphasize a lot on this, but the community there, like the people there, and also nature.
Yes.
Like if you're a nature lover, you're gonna love it. That there's a lot of hikes to go for with like the best sunsets. If you want diving, it's so accessible. The beaches are accessible, but you'll definitely enjoy. You'll have like a very good work-life balance there. As dentists, disclaimer, as dentists. Yeah.
If you could send a 30-second voice note back to your Kuala Lumpur student self on the day you receive your posting results, what would you say to her about the idea of career sacrifice?
I wouldn't call it a sacrifice. It's more of transformational growth. So, I mean, definitely it will be hard to adapt. On your first 3 months, you're gonna cry every day because you're so scared. You're living in a kampong house with different people, and then on your second week, you're gonna get into a car accident, and then on your third week, you're gonna go to the beach because I accidentally stepped on like sea urchins there, so like I had all the pricks down there.
Oh
it was
God.
bad. So it was tough like the first few months, and then your friends are like celebrating their birthdays without you. You will miss like family occasions like birthdays, weddings, funerals even. But the experience here is gonna be very gratifying. I would also say it's transformational because it makes you see things very differently. It's Malaysia, but it's a different part of Malaysia, and it's gonna open up your eyes to see like healthcare is not just like what you see in the textbooks. It is, a lot of things are factored in, like the culture, their beliefs, access, finance as well, and education level. So I wouldn't trade anything for like this last 4 years of experience. I would say it's one of the best phases of my life.
It's a privilege to have that.
Yes, it's a privilege.
Wow, that's cool. So, just to wrap up our whole podcast and just for fun, if you weren't a dentist today, what do you think you might be instead?
Maybe a full-time trader.
Oh, full-time trader.
I like to look at the charts and all that if I have the time to like read and then trade. Because I feel like it's also very analytical.
Wow, that's unexpected.
Yeah, I like those stuff. If I had the time, I would do more of that. But the analytical, and then you make your decisions when you're stressed. Kind of like dentistry as well, when you like do MOS and all that under stress, then you make decisions. Yeah, I like it.
That's unexpected. Okay, so Dr. Faith, it's been such an eye-opening conversation. So thank you for reminding us that dentistry is so much more than what happens inside the clinic. So it's also about people, purpose, and perspective. So back to our title. From city Kuala Lumpur to rural Sabah, is it worth it?
Yes, definitely worth it.
Yeah. So what do you guys think? Is it worth it? I think we'll let you guys decide after hearing Dr. Faith's journey today. And to everyone listening, thank you so much for tuning in. Once again, I'm Zhenshen, and this has been Nothing But the Tooth Podcast. Goodbye.